Welcome to the American College of Obstetricians and Gynecologists Video History. During this segment of our history, we're very fortunate to be able to interview a past president of the college, Dr. Frank Miller. Frank, welcome.
Thank you.
Thank
Ralph.
you for coming. We appreciate it here.
I'm thrilled to be asked. Thank you.
Well, we want to ask you while you're still here.
Yes, thank you for that too.
One of the things that I'd like to start with is to get a little bit of personal history about you and where you came from.
Okay.
Obviously, we've known each other for a long time.
We have.
But I will ask you the questions anyway. Let's begin with your background.
Okay.
Where were you born?
I was born in Murray, Kentucky, and lived there until I left college. I went to college in my hometown, and went to the same college my dad went to. And he graduated in 1927, and was in the first four-year graduating class at what was Murray State Teachers College at that time. But so I went to college there at Murray State, now Murray State University.
When did you first decide that you wanted to become a physician?
You know, when it was never just a defining moment. I just looked around, and when you're a youngster, you're trying to decide what you'd like to do, and the choices, it seemed to me, were fairly limited. I mean, I had no idea about things like oceanography or any of those things. So it was either being a banker or a businessman or a farmer. So I was interested in people. I was interested in physics and physiology, and it just seemed like a natural to me.
Where did you go to medical school?
I went to the University of Louisville. At that time, Louisville was the only medical school in Kentucky, but I started in medical school in 1958, and University of Kentucky opened their school in 1960. So I was from 58 to 62 at University of Louisville.
Louisville started way back, didn't they?
Yeah, it's an old school. It was a combination of two or three smaller schools in the city of Louisville way back in the 1800s. And so I don't know the exact origin, but there has been a medical school in Louisville since the late 1700s.
Frank, you're a student at the University of Louisville School of Medicine.
Yes.
When did you decide you wanted to go into obstetrics and gynecology?
I think it was when I was in school. At first I had thought that I would be a general practitioner. That was my plan. In fact, when I finished school and when I was an intern, I actually had signed up to go into a practice with a physician in my hometown, back down at Murray. And during my internship year, I was told that I was going to be drafted. And then at the day after I finished my internship, on Monday, the first day of July, 1963, I got the notice that I had to report in 5 days. So I went from Louisville down to San Antonio, Fort Sam, and I wound up 2 years at Fort Sam, Houston. And during that time, I was doing general practice, and I realized that obstetrics really was what I wanted to do. So that's when I decided that's what I would like to make my career, and when I decided to do a residency.
I think there were several of us that got that letter in about 1962, 63.
We did, yes, we did.
I remember that letter very well.
Yes, that was a shock.
It wasn't a very polite letter about your friends and neighbors have selected you. It was, you are hereby ordered to report.
My story, I think, is an interesting one in that I was told during my internship year, you'll be drafted sometime within 6 months of the time you finish your internship. And so I had lined up to cover locum tenens for some fellows there in Louisville. And so I finished internship on Sunday, and of course I had to work Sunday night. And Monday morning, first day of July, I'm a licensed physician in the state of Kentucky. I go down, I shower and shave, I go down to the hospital cafeteria, have breakfast, I go over to this guy's office. I'm seeing patients at about 11:30. The nurse said, Dr. Miller, your wife is on the phone. She said it's urgent that she speak with you. And I was surprised at that, and I answered the phone, and Pat said, Frank, the mail just came, and your draft notice is in it, and you have to be at Fort Sam in 5 days. So I told the nurse that I've just been drafted, and I'm not ready. I'm going to have to leave. And so I saw patients until noon, and left, and they had to call that poor doctor. He was on his way to Florida. The state police found him somewhere, and he obviously got someone else. Then I wound up staying in the Army for almost 15 years. So I tell folks that I was in private practice for one half of one day for the first 15 years after my internship.
So you took your residency in the military.
I did.
Which program?
I was a tripler.
The Tripler Army Medical
In
Center.
Hawaii, yes.
And how did you like it there?
Oh, loved it. Absolutely loved it. Again, you know, you tell people you want to have a busy residency, and I said I didn't mean this busy, but it was really a busy, good residency. We had good teachers. It was a great place to be.
Who was the chair at that time?
Well, the first chair was Jim Austin. And then he, after my first year, he left, and Dan Vaughn came in, and then Dan was there. But Bob Rogers was there the 3 years that I was there. Bill Scragg was there, and several others. Well, Jack Dorian, who had been at the University of Kentucky. And in fact, Jack is the guy who got me interested in high-risk obstetrics, now maternal fetal medicine, because I always thought he was more like an internist who happened to deliver babies. But he was very academic, I thought, and I really enjoyed his approach to obstetrics. And when maternal fetal medicine became a subspecialty, that's what I wanted to do.
He actually taught me how to do amniocentesis.
I knew that he was one of the few who had any training in amniocentesis, and I remember that he went to the University of Hawaii and helped do that.
Yes, he did that.
Yeah.
What was your first position post-residency? Where did they send you?
I went to Germany, to the Second General Hospital in Landstuhl, which is the referral hospital for Europe, and that's where all the casualties now from Afghanistan and Iraq go. And it was a busy OB service. Bill Scragg was the head of the program, and so I was there for 3 years. And the first year I was the assistant chief, and then Bill left, and then the next 2 years I was the chief of the service.
And where did you go after that?
That's when I did my fellowship, and I asked the military if they would sponsor me as a fellow in maternal fetal medicine, what was called perinatal biology at that time. And one person had done it before, Al Killam. And Al had done his fellowship in Denver at the University of Colorado. And so, but they said, yeah, we would, if you would like to do a fellowship, you can do it as a civilian fellowship, military sponsored. So I looked at and interviewed at LA, USC, and at Denver. And the program I liked the best was because it was the USC, because that was the more clinical program, and that's what I was interested in.
I think at that time it was probably the hallmark of all programs like that. They had really developed something that most people were looking at as to why do we need it.
Yes, yes. It was one of the most exciting times in my career. Everybody, in academic medicine in this area, at some point came through there. And because Ted Quilligan was the chair, Ed Hahn was the division director, Roger Freeman was there, Dick Paul was there, Bart Martin, Yuji Murata, see it, yay. It just goes on and on.
It's like a who's who of the maternal fetal medicine.
It really was. It really was. And it was just great fun. It was exciting. I could hardly wait to go to work every day and just hear what these guys had to say and how they approached obstetrics. It was just so different from what we'd had before.
And where did you go once you finished your fellowship?
I went to Walter Reed. And Colonel Pateau, who was the head of the obstetrics in the Army, had told me that he would like me to go to Walter Reed, and I certainly thought that was fine. But then Bob Rogers was the chair at Madigan, and Madigan had a busy OB service, and Bob had asked me would I come and work with him, and Colonel Pateau said, well, if you want to do that, you can. I would agree with that. I went up and interviewed, and while I was there, the word came out that they were going to discontinue the teaching program at Madigan. And I thought, well, I've spent all this time, in a fellowship. I don't want that. Well, of course, that never happened. But on my way back home, I stopped in at Letterman, called Colonel Pateau, and I said, Colonel Pateau, if the job at Walter Reed is still open, I'd like to take it. And he said, done. So I went to Walter Reed.
And how long were you there?
About 3.5 years.
During this period of time, did you have any special interests besides just general obstetrics?
Well, of course, at USC, the big emphasis was on fetal monitoring, and Dr. Hahn was the director, and so many things in fetal monitoring were being developed there. The contraction stress test, then the non-stress test originated there, and I was very interested in fetal monitoring in preeclampsia and its origins, and so those were the areas that I did most of my work in.
When you were at Walter Reed, did you have any special research interests?
I did, and again, what I was interested in was how you could evaluate better the fetus during labor or even pre-labor, and so we did. I did one study with John Reed. John was a resident on acoustic stimulation of the fetus to see if we could elicit an acceleration of the heart rate. And I think that was the first paper that was ever written on as noise as a stimulation for the fetus as a test. We did some work with glucose levels and fetal heart rate. So those were the areas that I was working in.
And after Walter Reed, what came next?
Well, I went back to USC. I was at a turning point really in my career because I'd been in the service about almost 15 years, 14 and a half years. And if I made the decision to stay, I'm sure I would have stayed at Walter Reed. And it was a great place, but there was so much going on still at USC. And in fact, UC Irvine had just started a new program, and they had a new chairman, and he had been at USC. And Roger Freeman called me and said, Phil Desaya is going to be the chair at Irvine, and he needs someone to head up his maternal fetal division, and I recommended you. Would you be interested? And I said, well, yes, I would be. And so I went out and interviewed, and while I was out there, Dick Paul said, well, if you're coming out this way, then you should interview with us too. And I did, and so then I decided, well, I'll go back to USC rather than go down to Irvine. And so that's what got me started me thinking that well, maybe I should get out of the service, and I did. And so in 77, we went back.
And what did you do at USC?
I was the assistant division director under Dick Paul, and we, again, were dealing mostly with interpartum assessment of the fetus. We had a lot of fellows, and I worked with fellows, and I was wrote a lot of papers at that time, and that was exciting.
How long were you there?
6 years that time.
And then where next?
Then I went to University of Arkansas to be the chairman, and I was that was in 1983. And,
Why Arkansas?
well, it was really interesting. Arkansas, is not, when you think about medical areas, centers, that doesn't just jump to your head, but they had a very strong children's hospital, one of the best in the nation, as it turns out, Arkansas Children's Hospital. And the people there were really good, and I had met a couple of them in one of the medical organizations that I belonged to, and we were talking about all the exciting things they were doing. In fact, just down the road near Pine Bluff, Arkansas, there was the National Center for Toxicologic Research. And it was out in the woods, because they had all kinds of dangerous things that they dealt with, but they had equipment that could measure any kind of materials, trace materials in blood. They had an animal colony. They had all kinds of research facilities, and they made many of those available to us, and the pediatricians were already doing some of that, and so I thought that would be a great opportunity. It turned out it was. Don Madison, I recruited to come down, and Don did a lot down there, and he left and was the dean of the School of Public Health at Pittsburgh after that, and now he's back at the NIH. So it turned out to be a very exciting place to be and a good time to be there.
Actually, Arkansas has a long history of being leaders in OBGYN. Go back to the time of Willis Brown.
Yes. Willis Brown was the chairman was the president of ACOG, and of course everybody was proud of Willis Brown down there. I never met him. That was before I was there, but I heard a lot about Willis Brown, and so they had, and of course from Kansas,
Kermit Krantz.
Kermit Krantz had been there.
He was there also.
Yes. And Kermit, I used to talk with Kermit about what he did in Arkansas. And he had a good time there too, he said.
And from Arkansas, where next?
Then the University of Kentucky asked me if I would come and be the chair. Dr. Green, Jack Green, had been the first and only chairman at the University of Kentucky when it started, and I think he started in about 1962 and had been the chairman for 27 years or something like that, and he was ready to step down, and Emory Wilson was the dean, and Emory is an obstetrician, an ACOG member, and so Emory recruited me to come there.
And you're still there?
And I've been there ever since, yes. Yeah.
Tell me, when was your first involvement with ACOG?
First thing I ever did with ACOG was when I was a resident, I presented a paper at the Armed Forces District meeting in San Diego, and it was on it was on fetal macrosomia, big babies, and I was so nervous. It was a great meeting because a lot of famous people were there, and I had to get up and present, and I'd never done that before. And I was so nervous, but I got it done, and it was a lot of fun. And that was my first involvement.
What's happened since with your involvement?
Well, after that, then when I finally got back to USC as a fellow, then the group at SC did a lot of presenting at ACOG meetings, particularly the national meeting like this one. And so I was invited to give some talks, and as I worked up through the organization, I gave talks and became kind of a regular presenter at the ACOG meetings. And then when I went to Arkansas is when I really got involved with the organization. But until that time, I'd just been really more of an academic guy talking at the meetings. But Pete Hollis was the district chair, and Jim Youngblood was the vice chair. And they invited me to help them with the scientific program for the district meeting. And in fact, I was the assistant scientific program the first time. And then they had the meeting in Arkansas, and I was the scientific program director. And then they invited me to be the secretary treasurer. It was an appointed position, not an elected one. And so I was the secretary treasurer, and then got into the line, and then I was this assistant or the vice chairman for the district, and then we left. And I never did get to be a district chair. But that was how I got involved, and I really enjoyed that. It was such a good organization. District 7 is, it certainly was then, I think probably still is, one of the best of the districts.
Tell me about your national committees you've been on.
Well, the first one I was on was the Scientific Program Committee, and that was exciting. And in fact, we worked on it together. It was a great group, and I really enjoyed every minute of it. And that's what got me really going with the college and going to the meetings and meeting more people. So that was the first one, and then from there, I was on one of the development committees and several others. Like right now, I can't think of the ones, but that's how I got involved, really.
And then you became president.
Yeah. Then we went to Kentucky, and in District 5, they asked me if I would be the junior fellow advisor, and I did that. By that time, though, I had, I was in a position where if I was going to seek a national office, it was time to do it. And so I asked them for their support, and then I ran for president and was fortunate enough to be selected. And that really was I think kind of the crown to my career. I really enjoyed that.
Would you say that's the most memorable experience you had at ACOG?
It was, the whole time, the 3 years that I was involved at the national level was by far the most memorable, but not necessarily the most fun. I really enjoyed the scientific program so much.
If you could make one change in ACOG today, what would you do?
The problem that I see is in the fellows is apathy. I mean, they don't seem to appreciate how much ACOG has done for them, how much more it could do, and how little it really requires of them to make a difference. And I know we've tried everything, and I don't know how to do it. But if there was something I could magically do, that's what I would do.
Let's look a few years into the future.
Okay.
And look at our specialty. What do you think you see in the future of our specialty? What are the issues?
I think, I really think that patient safety is the issue. That that there are, I focus mostly on obstetrics, and on the GYN side, I don't really have as much, haven't given it that much thought. But in obstetrics, it's safety, and I know we can do better than we do. And I think that the standardization that we're now beginning to accept is, I believe, going to make the difference. Everyone has said medicine is pretty far behind in standardizing our approach to problems. And the industry has done it years ago. And when we do standardize it, we get a better result, a better product. So I believe that's going to be it. And I'm excited about that. I don't know what's going to happen with laborist. I mean, the concept of laborist is one that's been around a long time. In Europe, they've done it for a long time. I like the idea of having someone always present on the labor floor who can make a decision and who can intervene when a problem arises, because so many of the problems we have are things that come up suddenly and the right decision maker is not there, or the person who can do the operation or the delivery is not there. In that regard, I think laborists would make a big difference. The problem is going to be the relationship that we develop with our patients, and then turning that care over to someone else in the hospital for the delivery. We're not there yet, and I don't know how. I know in some places in this country we're doing it already, but I think something along that line, as a change in the model of practice, is going to happen.
Do you have laborists at Kentucky?
No, we do not. But I think one of the hospitals in Lexington is planning to hire a laborist. In residency programs, we always do have somebody there, and senior residents who are about as good as obstetrics as most anybody. That part in all academic programs you have, but it's still not quite the same. I think you need someone there who helps make the rules and helps teach people the proper or the standard way to approach things, and then can make the decisions when necessary. I believe that is going to make a difference.
Now, do you envision this person as a faculty member or as a senior resident or a fellow?
No, I think it'd have to be a faculty member, and although it's repulsive to me in a way to think that this person would be an employee of the hospital, but it almost seems that's the way it's going to go.
Let me, as we're ending the interview, I'd like to ask you a question.
Sure.
You're involved with a lot of young physicians. You see a lot of young physicians.
Yes.
What would be your advice now to medical students or that were considering going into OB? What would be your advice to them today?
Oh, I think it's still a great a great field to go into. I have absolutely no hesitation in recommending obstetrics and gynecology as a career. My oldest son is an obstetrician, maternal fetal medicine, and I would recommend it, and in fact I do, and I'm very proud of what we do.
Well, Frank, it's been a pleasure to interview you. This interview has gone so quickly, I didn't realize we were going almost to the end.
Yeah.
As you know, we've had a lot of times together and hopefully a lot more to come.
We have, and I've enjoyed them all.
Thank you very much.
I appreciate it.